at section B to look at what the phase 1 evaluation report should have contained. And should have put it right up on the screen, and I will after we talk about the first section, which is a review of previous studies and available data related to early childhood special education, including but not limited to findings and recommendations of the subcommittee's 2007 report and the findings and recommendations of the Office of Program and Evaluation and Government Accountability on Child Developmental Services. Did you find that to be adequate, the studies that they included, and according to the tenor of the law? I did.
Yeah, no,
I did. Any comments about any concerns? I know there.
Yeah, I did. I mean, they used 4 states typically when they compared their information, and I thought that was fine. You know, I can't do all 50 states, that's for sure, and I don't know what the best 4 to pick were. So I don't have problems with that.
Yeah, I appreciated the large list of reports that they put out. It seemed extremely adequate. Is there anybody who did have a concern? Hearing none and not being surprised, let's move to the next one. And actually, I'm delighted to say I can share my screen so that everybody can actually see this. There it is. So moving to the next, which is in this section, an in-depth analysis of national trends and relevant models of governing, delivering early childhood at special education systems in other states and jurisdictions that hold the potential for enhancing the effectiveness, efficiency, and accountability. Did you find that adequate? I did.
Yeah.
Anybody?
Yeah.
Anybody not find that adequate? All right, moving to the next one, which is the question. Was an in-depth analysis of the short-term and long-term costs and benefits of the proposed plan to restructure CDS. Now, I'll be perfectly honest with you folks. I thought that the cost study was extremely well done, but I didn't necessarily, I would have liked to see some kind of basic chart that would have explained to me kind of what the short-term and long-term costs were, or it wasn't easy for me to tease out. And it's possible that I just didn't see it. I'd like that to be in a clearer, more condensed version. How did you feel?
I felt it was a level of detail that was confusing to me, and I'm a finance guy, to be honest with you. There's some tricky aspects to the cost in the state of Maine and how it gets identified, and seed money and IEP and ITPs and how they're broken out. And it just was kind of, I think a lot of the information was there, but for somebody to call a clear understanding that doesn't delve in this, I just thought there was a lot to try to get to. And I haven't made any comments yet. I plan to make some written comments to, you know, from my perspective on some of those issues. I just haven't had time to do that yet. I don't know if that's saying the same thing you said, Nancy, but I can give a couple examples if you wanted. But.
Well, and let's hold off on the substance about let's just go through these 5 things of, did it do what the contracts say it was supposed to do? And I'm not sure that I think it had a lot of information, a lot of really good information, but I would like to see something, because of what the contract says, I'd like to see something very clear about the short-term and long-term cost benefits for the legislatures to be able to look at, and negative of their of the proposed plan that even if that they put in. Because what we're asking the education committee to do is decide whether they like it or not. And or that's what this PCG report is going to do. And does the committee have enough information? Is it clear enough that they are going to know what their opinion is? And I don't think so yet. I wish it was a condensed, clear, here's the study, this is our projected cost. But it might be that they can't.
So I do want to jump in here really quickly. I know PCG has sort of discussed and gone back and forth whether they were going to present the information in regards to LD 1715 sort of as one separate section or embed it in the report at the parts that it's relevant. And I do know there was a preference expressed by the project leadership here that they really embed it in the parts of the report as opposed to just doing one separate section. So just to let you know, that's sort of a looking forward to what the education committee will see, and that was a preference that was expressed.
And that makes sense, but there's a lot of good nested nuggets, but is it enough? I don't know, maybe it is. That's not the one that I'm most concerned about. What do other people think other than Pete and me? We'll talk your ear off all day. Roberta, what did you think?
I think that the committee had a hard time, PCG people had a hard time coming up with that information that you're looking for in reading this and looking at their cost analysis report. I think they found some challenges doing that.
And they put some really good advice, especially around around coding,
Yeah.
And
For main care specifically, yes.
For main care specifically. So do they simply need to say that, or is it just done? It might be just done. How about the next one? An in-depth analysis of the impact of the proposed plan to restructure CDS is presented as in the first paragraph, and I'll go up to that first paragraph. Did it cover all of these things? And I went down in mine. Did you folks get to go down and kind of see if all of these components were there?
No, I didn't get a chance to do that. I want to though.
The places that I found, I didn't see a lot about transportation. Did you?
No.
And I think that that's a key piece. I didn't see a lot about the plans to address the impact of local budgets. They mentioned using the EPS formula, and their work had local contributions, but they didn't go into how that will affect folks. I'm not sure if that will get in the way, like a method of assessing the school administrative unit's capacity for implementing this. Part of that is about funding. Tiffany, did you see anything? Sue? I'm seeing you say no, Sue. You're on mute.
Yeah. I don't think I have anything to add. Transportation, as we know, is a huge barrier, and it isn't. I don't feel that it has been talked about much.
Yeah, those were the two gaps that I saw. Did anybody see any other gaps too? I'd like them to fill in those gaps, because I think based on what we paid for, they should fill in those gaps. It's important. People are going to bring up transportation seriously. Local school districts are going to want to know how this is going to affect, and legislators are going to have a lot of constituencies asking that. So those two pieces, I think, are gaps. And the last thing that's missing, although it's not as substantive to me personally, but I think it's important, in part B, a public information communication strategy about it, the implementation plan wasn't put in there. But I'm not sure that's the as much as transportation and local budgets and local ability. Is it okay with all of you? We don't have a quorum. Is it okay if Hillary includes those two pieces to feedback for PCG?
Yeah, I have just a question before we leave that area.
Good, please.
It's an in-depth analysis of the impact of the proposed plan to restructure CDS as presented. And I think the legislature was asking for options, you know, as much as a recommendation. I might have misunderstood that, and please correct me if I'm wrong, but the recommendation that they had towards the end was clearly a recommendation. It wasn't an option. You can either do this and this will happen, or that and that will happen. It was, you know, a centralized recommendation. And to me, that recommendation was that CDS, the 3 to 5 year olds should go to the SAUs, and the 0 to 3 year olds should stay with CDS. At least that's the way I read the report. Did other people read it that way, or did I miss something?
I did. I read it that way, and I read that there's a huge opportunity to enhance our least restrictive environment and doing more in inclusive education. But that is I think the conversation we need to have about that is that's a big one, because it talks a lot in the report about how, what is it, 4% of special purpose programs in other places, and we're at 20 something percent. It was substantial. So I do think that that's something that we need to talk to the education committee about, but I'm not sure if that's something we give to the PCG.
Yeah, well, I think it's, I think understanding the intent of the legislative committee is important, and I misunderstood that.
Hillary, I actually went and looked in the contract again, because I thought that options was there too, but I don't remember what VVVV said. Do you remember? You're on mute.
Yes, I am. Okay. It specifically asked for recommendations, and I think this was a lot of the conversation that we had when we first started this and first started with the RFP, was trying to make sure that the contract made it a little bit more clear that there wasn't a set plan going into this. And so that the education committee would get to read the recommendations and make its decision on how they wanted that second phase to go. But I do think this conversation goes a little bit more into advising the education committee how they want to move forward for the implementation plan.
Yeah, and that's the way I read it. And I don't know if that doesn't really give options, though. It's just, this is our recommendation. And then the legislature then needs to say, oh, okay, you know, that's the only option we have. You know, to me, they missed the mark there. To my understanding, like I said, if I'm understanding the intent correctly.
No, I get what you're saying. I thought it was options too. But when I go back to the right array in the contract, it says of the proposed plan. So it's like PCG can come back and say, we did what the contract said. And that's,
takes the decision away from the legislature, you know,
and that's a
not have
concern.
options. So that's my 2 cents anyway.
So I'm going to just hop in here as a member of the committee. I concur with what Hillary said, it was our intent that this wasn't just simply a review of the proposed implementation from the department or legislation from the department, that there be other possible approaches to providing these services, so that when we convene to look at the report, we can have choices. So I would concur with your interpretation.
So that brings us to the question of whether or not we go back. And I think hearing Senator Millet's point and hearing Hillary, we go back to PCG and say we expected options here for the Education Committee to have a range of discussion. Rico the dog apparently concurs, and I apologize for that. What do you think? Hillary, is that practical?
I am here to communicate your position.
Well,
Now, what PCG ultimately does with that and what they bring
Right.
forward to the committee and what changes that they're able to make, that might be a slightly separate conversation. But absolutely, if you feel that wasn't adequately represented or that needed to be included and it's not, then I can communicate that to PCG on your behalf.
I think that makes sense. Other comments? I'll stop talking.
I would agree with that. I would like to have those options there. We'll see what the options are.
I agree as well.
For those in present of the committee, we're in concurrence that we would like to have options for the Education Committee to agree upon. So please communicate that.
Can I share one example of how I think that it's important to have options? When you talk about local funding of this transition, you know, I don't think the SAUs, by reading this, will have a good feel about what their fiscal responsibility is going to be, you know, to take this on. And I think if they want to do that, they should clearly know that. The state should know that, and there could be some big surprises coming. And how can you make that recommendation and not know that answer to that question?
I think it's going to be, I think it's going to get in the way for the committee to be able to make a choice. I think that people are going to all storm the castle, so to speak, and say, we don't like this, we don't like this, we don't like this. And I think that when, and Senator Millett, please tell me if I'm wrong, but I thought that you folks wanted to hear a number of choices so that you guys could kind of wrestle that and make the best choice. So I know they're supposed to have it due to us in just a few days.
Yeah.
But regardless, I agree with all of you.
We, as a committee, are looking to the advisory committee to highlight any concerns that you might have.
Well, that's a concern.
And I would encourage we are turning to you as experts on the ground to let us know how good points as well, and also areas that need improvement or raise concerns for you.
Because I mean, when I heard SAUs speaking, and it's very reasonable requests on their part to say, if we're going to be responsible for this, then we want to be fully funded. Because one of the big issues that was throughout this whole thing was there's the position, I think, by reading this, that the system is underfunded. So if the SAUs are going to take on the responsibility, or anybody, you know, there's going to be that expectation that they'll be reimbursed through some cost mechanism or something. I don't know how. I don't know how that would all work, but you know, there would be maybe that's part of the implementation plan. You know, later on in phase 2. I don't know, but if we get to phase 2, is it too late to go back to phase 1 and say, oh, we don't like that, or is it just you know, you can't go backwards once you.
You know, this is a sticky wicket,
I know.
in my opinion, and the reason it's a sticky wicket is because we're going to have phase 1. The education committee is going to make a decision. They're going to have phase 2, and they're going to send a letter and present it to the next education committee. And one of the things that I was going to talk to you folks about is in phase 2, what kind of letter do we want to send to the education committee as well? So, I mean, this is the real work of this committee. And I think the more we can do, I think we need to do things as much in consensus as possible. And that might be really, that might be some conversations to have. But it's a sticky wicket. What can they do? The education committee can do anything. I think they wanted the advisory committee here to kind of not necessarily to prevent all of the number of political messes that might happen. That's happened over the last number of years. You know. So it's a very big process. Now is the work of this committee. I wish more of us were here. So, but this is what we've got. So let's go to work. I thought the cost study was outstanding. The cost study was a great piece of work. And there were a lot of things in there that didn't hit the phase 1 report. And that might be okay. That might be okay in a second, but it might be nice for them to explain in some of their options, some of the cost rating. I was disappointed in the report. It said, help the SAU's cost braid. I think that might be a lot asking everybody to individually do separately. But I was psyched that when they talked about a centralized billing, that really might take care of some of the fears of billing main care, which is a huge, huge deal. So I think that it could be a nuance of flushing up centralized billing a little bit to include some of the insurance companies. It's going to be a lot easier having insurance companies work with a centralized billing than every SAU managing that mess. And as somebody who worked on the autism law, if it's in each individual SAU, they're going to have individual contracts with each insurance company. It would be much better if the centralized agency did it.
You know, centralized billing sounds good. You know, when you think about it, there's so many different details that go into billing a claim, be it to commercial, main care, CDS. There's you know, credentialing. There's documenting the visit. There's all the elements that go with sending a bill. Isn't just centralized billing. I mean, that's the administrative task, and that's, I don't think, what the schools are afraid of. They're afraid of, oh, did I document it right? Is my BHP credentialed properly? Is the time in and the time out? You know, does it tie back to the goal? You know, all the elements that go with that, and if those things aren't all kind of lined up, and there's not the training and, you know, and all the work that goes with that, it's not, you know, it's centralized billing is decentralized documentation, but centralized billing, because that's the only way you can do the documentation is to decentralize it. And
I read it differently. I thought that centralized billing unit in whoever does it was going to help and make sure that if it's a main care or a Medicaid service, there's going to be documentation of the IFSP and the IEP. So they're going to do that, because it was my belief that the people were audit aversive.
Yeah, and when you say they were going to do it, the centralized agency is going to do that, or the SAU is going to do that?
That's what I believed was the agency, because the person who would be audited would be the state, and they're not going to want to be audited. Yeah, they're going to provide support, but
yeah, no,
that's the details in the wash.
Sure. sure. Yeah, and then they would, yeah, if they took on that responsibility and if that can make the schools feel comfortable, then sure, that would work.
So if I can jump in, I think we're sort of starting to move towards some much more substantive discussions about the recommendations in the report. Yeah. And so if I could just sort of start by recapping some of the technical edits we've been discussing to make sure that I have everything down correctly, and you can correct me if I'm wrong. And then if you do want to move to those substantive discussions, we can start that conversation.
Okay.
So I know one question was wanting a little bit more clarity, I think, on the short-term and long-term costs of the proposed plan. That was the first thing that Nancy had brought up. And then the second, going back to that sort of list of everything, was the transportation services and what data and costs and recommendations I have on transportation services, the impact to local school units and budgets, and a method for assessing a school administrative unit's capacity for implementing early childhood special education programs.
Yes, and I want to ask one more to especially you, Roberta. There was a part in here that kind of talked about using the category of developmental delay and not using the category of learning disabilities, and it talked about the different categories and how autism is. Some of that was simply factual data that they found. The mother in me of a child with learning disabilities looked at that. You shouldn't be diagnosing of a learning disability before the age of 6, and thought to myself, whoa, that's about 3 years ago. There's so much more. Is that true that we want to have a statement like that in there?
Well, I think we do want to consider developmentally delayed more than we
I do too.
That in my conversations with the Early Child TA Center, Maine is very low on their identification of developmentally delayed, and we've had some internal conversations about developmentally delayed and this age that we cut that off in Maine, and so we are considering maybe extending that, but that's something that we're, that's internal conversation that we haven't yet settled on or even moved forward on, but we are having a little bit of that, conceptually, what does that mean and how does that look as far as it affects identification of children, because developmentally delayed seems more appropriate for those 3 to 5 year olds than other health impairment possibly or learning disability.
Well, they actually say in here that learning disability is not appropriate for 3, 4, and 5, and I don't know where they're getting that data.
Well, evaluative tools that are
used. Other healthcare, right?
Well, but evaluative tools to determine eligibility for learning disability are not normed down to 3 and 4 year olds typically. That's why, and that's why it would be more advantageous to go developmentally delayed and then collect the data on those children that are exhibiting learning disabilities, especially around, speech and language and those language components.
Yeah. I certainly think that the other health impairment, that the overuse of other health impairment is concerning. That is a wide bucket.
It is a very wide, it's a very large continuum under other health impairment.
Absolutely.
Was that helpful for you?
Sorry. No, finish up.
It works for the context of this discussion. One day I might have a conversation with you about dyslexia, but it doesn't fit in this conversation at all.
Okay.
All right.
I
have more. The third one had to do with the broader issue of sort of expecting more options.
Yeah. I had one more thing, Hillary, to mention one more of the deliverables before we get to that, if I may.
Go ahead.
And that was the reconciliation of individual education plans, individual family service plans, and individual treatment plans. They touched on it, but in my mind, they didn't reconcile why the 3 to 5 year old population routinely gets 15 hours a week on a 30-hour treatment plan. As soon as they get to kindergarten, K through 12, it's 30 hours almost across the board. And it goes to the heart of seed money and who's paying for it. I don't want to get into the nitty gritty, but but I didn't see a reconciliation as to why is there such a difference? Why are these 3 to 5 year olds only getting 15 hours? And that's what they're recommending in here, in the K through 12, get 30 hours of treatment, when everything that I see, the best practice is for these early intervention kids to get 30 hours. And so that's a big cut here for those kids.
I didn't see them mentioning hours at all.
No, they didn't. They didn't. I'm just telling you what's happening in real practice.
Right, but I'm not sure that that particular analysis was within the scope of this particular project.
Well, it's the scope of the operations of the care of the kids. I mean,
It is, but I think it's an advocacy, but I'm not sure it fit. We didn't ask them to. They
No.
made it pretty clear that they thought that if we were not doing things individualized, we would, and if we weren't honoring LRE, we would be going against kind of well, the law.
Yeah, no, but what gets into the heart of how they're going to estimate the cost to local
Cost of services.
facility, local towns, and where that's going to fall out. It's a huge reconciling item. That's why we put it in here. I remember putting in that bullet myself, or I didn't put it in. I requested to have it put in. Hillary put it in. Thank you, Hillary. But it's such an important piece, and really the bigger discussion is, do these kids, the 3 to 5 year olds, should they be limited at 15 hours a week? And I don't think so. I don't think the experts don't think so. I'm not an expert by any stretch. And we can leave
About-
bringing it up as an issue. It's a huge.
Well, which one is it that you're talking about on the
H on page 5? It's H on all.
page 5?
Oh, no, yeah, on the
No, in the contract.
the contract, yes, page 5, yeah, letter
Page
H.
5 of the contract.
Well, it's page 5 of
Oh, I see.
rider A.
That's in quiz. That's in phase 2.
Oh, that's phase 2.
Oh, no,
Okay.
that's a phase 1 approach. Okay.
Yeah.
It includes, right? Okay. Well,
Well, in my mind, they didn't reconcile like what I.
Nancy, if I can jump in real quick. Based on the list, it's sort of in 2 places in the contract. It's also on page 3, number 8.
3. Oh, it is. Well, then that would, I personally thought they did when they were talking about the Medicaid rules, but there's no need, if the committee, all think that number 8 should also be in there.
They did on their costs. They did say
For section D.
that 55% of the cost is on the IEP and 45% is on the ITP. Or maybe it was the other way around. 55% was on the ITP and only 45% was on the IEP, leading a reader to believe that 45% of the treatment will be paid for educationally and 55% will be paid for.
Is it worth to, and I don't want, is it worth to, do you all feel, so Kim, welcome. What we've been talking about is what's not in the report. And I think largely what we've talked about what's not in the report is transportation, effects on budgets, local budgets. And we're now debating whether or not we should include this reconciliation of plans. And I kind of wanted to hear what Tiffany, Sue, Roberta, Aaron, Kim, if you have any strong feelings about that, if we should add it to the list that we've sent on or not.
I think we should add it to the list.
Okay.
I was interviewed by them about a week ago for MSHLA, and I asked them kind of some of that same stuff, why that wasn't in this. And I think some of that stuff is going to be in the phase 2 from what they were saying to me, that those might be phase 2 issues to them. But I think we should ask them anyways, just to see, because it was on our list. So
Good. Is there, then please, Hillary, there you go. Good enough. Is there anything else that we want to communicate to PCG?
So what I think probably makes sense to do is I will just draft these up tomorrow. I'll probably just do it in an email, especially since there aren't a lot of us here in this meeting right now. But I'll make sure to CC everyone when I do send it along to the PCG team. And that way, if she has any follow-up questions, like specificity questions on some of these things, she could reach out to understand a little bit more where you're coming from. And that's some information that I might not necessarily have. Just thinking about, when you're talking about the reconciliation and the hours, that's a depth that's a little beyond me. So I will make sure you're CC'd, and if they have follow-up questions, that they can reach out to you, if that works.
Okay, yeah, I'm fine with that, yeah.
So the next question, I found it difficult to kind of organize this meeting and how we're going to attack substantively this report. We have another meeting coming up, and I mean, we can capture some of the conversations. I know that there's the issue of 5 years to 2 years comes to mind as something that says, whoa. And
That's just, and Nancy, not to interrupt you, but that's assuming that their recommendation goes into place.
right. So
Yeah.
so perhaps we can each kind of give a quick summary of where your thoughts are, and then I think you guys, we should email. If you would email me, what are the topics to really start talking about, then we can organize the next meeting into some overall conversations. If not, we're going to take this 80-something page thing and not have any order, and that's just not my way.
Mhm.
So would that be okay with you?
Yeah.
All right.
So you're giving us homework.
I am giving you absolute homework, and I'm gonna email everybody else on this committee and really say, this is important stuff. This is really important stuff, and I need to hear from you, the legislature. You were appointed. This is a really big deal. Does this feel good to you? And how to do that? Sue, what do you think?
I think that's a good approach.
All right. All right, then let's take a minute and look at our timeline that's coming up. We have a meeting at, by October 9th, the PCG will get the edits. And these edits will also be shared to the Education Committee. And Hillary, are you in charge of sending that, organizing that? Do you need anything else from us?
Not at this time. I will let you know if when I start writing this up, I need any clarification or I have any questions. Yes, the Education Committee, I know some members are listening in today. If they have any additional questions, edits, concerns, that they're going to have a period of time that they can reach out, and I can compile those for PCG as well. If I hear anything back from PCG, if they're specifically saying, oh, we didn't do this because, I will do my best to share that with you as soon as I can, or at the latest at the next meeting on October 20th.
Then look, go ahead, Kim.
Hillary, did you see that? I want to say it was a week or two ago that Roy Fowler had emailed and had put some stuff in there, thoughts that he had of what he had read from the report. Did you get that email?
I know that Roy had sent some edits on the cost study report to PCG, and yes, they did get to PCG.
Okay.
All right. So my understanding, this is still very draft, and we might not actually see the new report before we start looking at comments. But I do think that we should take some time about really looking at this and say, what, based on what we have here, would we say? So it's only one plan here, and that's not what we wanted, and I understand that. But I think this is what we have to react to right now. And I think we'll be losing an opportunity to communicate to the Education Committee if we don't take it. And then we can edit it once we get more information. How do you feel about that?
I don't know. Are you asking us all?
You're one of the advisory committee.
Yeah, I think that if I was a legislator, I would want those options that I'm expecting, and if we feed them this one thing and say, well, this is what we're given, so we're gonna answer these questions, you know, I think that's misleading.
Well, that's not exactly what I meant.
Okay,
We have, the safety report is going to come back from PCG is on the 30th. And members of the committee are going to see and review the final report. And you and the advisory committee is going to have an option to be able to edit our comments and change our comments
good.
by November 3rd to give to the education committee. So I'm not
Perfect.
suggesting that we are going to give what we're talking about on the 20th to the committee, but I'm suggesting that that's how we begin our debate and discussion, because the difference between
Yeah.
November 3rd and October 30th is like nothing.
No, it's not long. Sure, I get that. So I'm okay with that, Nancy.
Right.
Yeah, I'm fine.
And we make sure that in
I'm just
there,
one vote on the committee. You know, I understand that too. But
I do think if you anticipate making some substantive changes to your recommendations, you will probably have to have a meeting, a public meeting to do that in that time period. So you do want to keep that in mind. But we can cross that bridge when we get to it.
sure.
I think we're going to probably have to with these is to have a public meeting about what we ultimately want to send off. But if we could get the bulk of it done on the 20th and be able to have some yes and no's just before it's given to the education committee, because it's a very short amount of time, that makes sense. All right. Knowing that we have 10 more minutes, and Pete, you're not, the problem with me in a chair position is I don't shut up. So I'm going to be very clear to stop talking. Did I just say that over YouTube? Oh boy. So there we go. So if you'll email me your concerns, and I will send out an email to all the advisory committee, I will draft an agenda that includes all the topics that are brought up, and we can have a targeted conversation, which will also stop me from talking so much about things. Sound good?
Yes.
Okay. It's is there anything else that needs to be done in this meeting, or do we adjourn until the 20th?
Don't need anything from my end.
I really thank you. Please, you know, as I said before, I see this as a really important role to figure out what to provide the education committee for them to decide after about this report and the phase 2 report, and then ultimately the next education committee as well. So I thank you for your all-in kind of atmosphere in the middle of a pandemic. So I thank you very much in the middle of figuring and juggling all the other things that you're doing.
Thank you, Nancy. I think you're doing a really good job in keeping us going forward. I appreciate it.
Thank you, Pete. And I want every voice to come into this conversation. So I very much appreciate you all. All right. Take care, and I'll talk to you soon. And I look forward. Please send me things if you sent it to me by the 15th, which is a week from Thursday, I can get an agenda out to you no later than the 19th, which is the day before, but we'll have a targeted meeting to really look at it. Is that should I ask you to get everything to me for the 14th so you can have an agenda by the 16th? Yeah, that makes more sense. Then you have a couple days to really review and ponder these things. As my associate director, Rachel, says to me regularly, Zoom is for people who like to talk. And it's really important that we make space to the people who don't, to get their ideas out.
You can mute everybody being the leader, or if people are talking too much.
Doesn't help when I'm the one talking too much. So, all right. Thank you very much. I'll see you soon. 14th, I'll get an email out to you folks tomorrow.
Bye.
Bye.
Thank you.
Hillary,